Aggressive marketing is taking place for this drug these days. It's the most powerful antioxidant, and it's often called the mother of all antioxidants. It can prevent premature aging, strengthen your immune system, and even improve your focus. But the reason this drug is gaining a lot of traction in the market today is not because of these reasons. Hi guys, welcome back to MedNuggets podcast. In today's episode, we will be talking about all about glutathione for skin whitening. So before we get into the details of whether this drug really works or not, let me tell you what glutathione actually is. So glutathione is actually a small, low molecular weight, water-soluble peptide. So it doesn't stay long in the body when taken orally, and that's why IV glutathione is said to be preferred. So there are three forms of glutathione, which is the topical form, which can be applied as a cream, the oral form, which can be taken as tablets, and the intravenous form, which can be infused or given as injections. Right? So out of these three forms, only two forms to date has been FDA approved. The topical form is FDA approved, however, the effect is minimal. The oral form is also FDA approved. Once again, like the topical form, even in the oral form, the effect is minimal because the bioavailability is low, which means when you take the tablet by mouth, only a lower amount of the active form of drug reaches the skin where it produces its effects, which in this case, where it causes skin whitening. Right? So IV glutathione for skin whitening as a skin whitening treatment is not FDA approved. And why is this? So has this question ever crossed your mind? Why isn't it legal? Why isn't it done in hospitals? Let's break this down to you, right? So what is this FDA? That's the most important question, right? So FDA stands for Food and Drug Administration. It's this body that's responsible for protecting the public health. It makes sure that drugs are safe and effective, right? Especially safe for you. So if a particular drug is FDA approved, that means it's safe. We know the safe dose of the drug that needs to be taken for it to produce effective results. For example, if we take paracetamol, we know that doses less than 75 milligrams per kilogram given within a 24-hour period are very unlikely to be toxic, whereas a dose of around 150 milligrams per kilogram could kill you. So we know this information thanks to all the clinical trials that were performed on this drug, isn't it? So when there's enough clinical trials or evidence to back up a drug, the FDA approves it after a thorough evaluation, right? Now, what's the issue with glutathione? The FDA has not approved IV glutathione as a skin whitening treatment because there's not enough clinical trials. There's not enough information about this drug. We don't know the exact dose that should be taken to produce a considerable amount of skin whitening. We don't know the dose that can cause serious complications. We don't know the dose that can damage the vital organs in your body, right? So basically, we don't know the dose of drug that can kill you, right? So far, I think there has been only four clinical trials, isn't it? 4 clinical trials done on this drug, done on glutathione, right? Which is definitely not enough information, And some people, they just buy they just buy a glutathione drip online and self-inject, So we don't need doctors anymore, I guess, Yeah. And so it's because of this low bioavailability. So, the FDA has approved the topical and oral forms of this drug, but it's because of this low bioavailability, people want to get it injected into their system. Because when you inject something into your blood, it becomes 100% bioavailable. Means all of the drug that you inject will reach your skin to produce that desired effect, to produce the skin whitening that you guys want, right? So if talking about IV glutathione, it's used by doctors to treat only certain diseases. It's approved to treat only certain diseases like, cancer or liver disease and even Alzheimer's, right? So these are legit medical procedures performed in the hospital by a clinician, right? So, and the other thing is glutathione is also known as the mother of all antioxidants. It's the most powerful antioxidant, and we say this because it fights free radicals, which are everywhere. Basically, sun exposure, free radicals are everywhere in our body, right? And these free radicals, it can cause premature aging, hyperpigmentation, and even cancer. So free radicals are basically your enemy, right? And what antioxidants do is it neutralizes the free radicals, right? It neutralizes it neutralizes your enemy, right? So due to the multiple benefits of glutathione, like it can slow down aging, it can strengthen your immune system, it can improve your focus and even your quality of sleep. So because of these multiple benefits, yes, glutathione is something that is good. It is good. But the thing is, you can easily get glutathione from your food, right? There are certain foods that you can eat, which we will be discussing later in our podcast, right? That you can get glutathione from, right? Just because glutathione is the most powerful antioxidant in the whole body doesn't mean that it's safe when taken in high doses, right? Actually, skin whitening was noticed as a side effect of glutathione. Did you know that?
No, I didn't.
Yeah, it's actually skin whitening was noticed, guys, as a side effect of glutathione, right? So another question you might have is, how can glutathione cause skin whitening, right? So what glutathione does is it stops this enzyme, this molecule tyrosinase, from working. So what is tyrosinase? Tyrosinase is this molecule that makes melanin, right? So melanin is what makes your skin dark, right? So if tyrosinase stops working, your skin will transform to a lighter shade because of an increase in something called pheomelanin. Now, this brings us to the question, what is pheomelanin? So guys, in our body, there are two types of melanin. There's eumelanin and then there's pheomelanin, right? So eumelanin is this brown colored thing that you get in your body, and pheomelanin is lighter in color compared to eumelanin, right? So if you're someone with dark skin, means you have more of eumelanin, right? So if you're someone with lighter skin, means you have more of pheomelanin, the lighter colored melanin, right? So if you want to get a lighter skin color, you basically you want to switch your melanin production to pheomelanin, isn't it? Because that's what makes your skin lighter, right? So studies recommend taking around 600 to 1200 milligrams for skin lightening, which should be injected 1 to 2 times per week. But the thing is, we don't know how long you should keep injecting this for. Is it for months? Is it for years? Right? And if we keep injecting this for years, will it lead to any health-related complications? Right? Will it be harmful to your body? So these are questions that we don't know the answers to as of yet. Right?
Because only a few research studies have been done on this.
Exactly. Only 4 clinical trials have been done, right, regarding this. So, why don't you explain the clinical trials, Winry?
So one of the clinical trials is it is a randomized placebo-controlled trial which involved around 60 medical students from Thailand. So they were given oral tablets of glutathione for 4 weeks. And another pilot study used again oral tablets of glutathione for 8 weeks, and this was done in Philippines. So both of these studies, they showed a reduction in melanin production, and only one subject reported erythema of the entire face, which also subsided after a day.
Yeah, erythema of the entire face means, guys, redness. Basically, your skin becomes swollen and red, in your face. So that was reported by one subject. One subject was,
that was in the Philippines
study. Yeah, so also you talked about this Thailand study, right, Vinori? Yeah, the one where 500 milligrams was given per day for 4 weeks.
For 4 weeks.
So in this study, guys, right, 500 milligrams of oral glutathione was given per day for 4 weeks to these subjects, to the people who were, to these people who were tested, right? And in this study it produced statistically significant results, right? But skin whitening was only observed in 2 sites, in 2 regions of your body, right? That was in 2 regions. That is in the right side of these participants' faces and on the sun-exposed left forearm. So basically, when you take a tablet orally, it's supposed to produce a generalized skin whitening effect. It's supposed to make your entire body, it's supposed to lighten up your entire body, right? Make your entire body whiter in color. But the thing is, with the oral form, only two regions of your of your body was observed to produce this skin whitening effect, right? So I mean, it's up to you. That is, these are we are explaining the results, of these studies.
Yeah, and there was another study which was a randomized trial in Philippines. They had 30 women, and they applied topical 2% glutathione lotion. So this also reduced melanin production. So all these studies did not show any serious adverse effect. But the limitation with this study, the problem with this study is that the sample size is small. They in the Thailand study they only use 60 medical students, and in this topical study in Philippines they only use 30 women. Right?
So all these are healthy people.
And also healthy people. So you cannot generalize the results of these studies to a larger proportion of people, right?
Yeah.
Because it's only less than 100 people and all healthy people. So the sample size is very small.
Yeah.
And also they were only followed up during the study period. So that is 8 weeks or 4 weeks. They were not followed up for a longer period of time. So maybe they developed the adverse effect after 1 month, after 1 year, after 2 years, right? So they were only followed up during that during those few weeks when the study was done. So these were some limitation of these trials which tested the topical and the oral form. And so even though there were no adverse effects with the topical and the oral form, the adverse effects were reported with the use of intravenous glutathione. So this was documented from Philippines, which is one of the leading consumers of glutathione. And the FDA of Philippines, they issued a public warning regarding the safety of off-label use of glutathione injection, and also the adverse drug reactions that were reported from the use of intravenous glutathione for skin lightening. And they suggested that these adverse effects may be attributed to other compounds, additives that are present in these glutathione injection vials. And maybe the risk would be minimized if pure glutathione is used instead. But again, there are not enough research to confirm this fact. So the adverse effects can range from minor side effects like skin rashes to serious and potentially fatal conditions like Stevens-Johnson syndrome and toxic epidermal necrolysis.
So, guys, I mean, if you don't know what Stevens-Johnson syndrome and toxic epidermal necrolysis is, just type it on Google and look at the Google images, you know.
It's frightening.
If you still want to, go for glutathione injections, then I don't know what to say.
And they are dermatological emergencies, right? So basically the skin starts to slough off and peel off. And it happens quickly, and it is an emergency, and it is life-threatening. Because when your skin peels off, you don't have a barrier. So you lose hydration, and you can have electrolyte abnormalities that could cause you to die. And the other side effects were thyroid dysfunction and also kidney failure. That is probably due to the high dose of IV glutathione that is used. So this can overload the renal circulation, the blood circulation that is coming to your kidneys. So this could result in kidney failure. And also you can't get the effect of high dose glutathione, that is the effect of skin whitening, with low doses of glutathione. You need to use high doses, and this can have serious side effects.
And as we mentioned before, right, this skin whitening is actually a side effect of high doses of glutathione, right?
And also severe abdominal pain was reported in patients who received twice weekly IV glutathione. And apart from these adverse effects from the molecule itself, that is from glutathione itself, incorrect injection techniques by untrained staff can also lead to lethal complications, because you don't get IV glutathione in hospitals. These are mostly given to you by cosmetic clinics, and which do not have well-trained staff, right? They're not doctors.
Actually, only healthcare professionals can give you IV injections of a drug, Other people, they can't, they're
not trained
to do that.
So this can lead to lethal complications like air embolism. And also, if they're using unsterile or used needles, it can also lead to a bloodborne infection.
Like AIDS and stuff.
And other side effects were lightening of your hair color. This was also
Really?
reported. Yeah, it can also cause your hair
Like
color.
lightening of your...
Yeah, basically like bleach your hair color. And also hypopigmented patches, especially on sun exposed areas of your body. This can also this is also one of the side effects. And also when you take anything from outside, it signals your body to stop its own production. So when you
Yeah.
take glutathione, your body will start depending on these synthetic supplements instead of producing its own stores, right? So in your liver, your glutathione stores will decrease,
Yeah.
and this can also be devastating to your health.
Yeah.
And also it has shown to exacerbate the risk of peptic ulcers, Helicobacter
okay.
pylori associated peptic ulcers. So Helicobacter pylori is a bacterium that is known to cause peptic ulcers and even gastric cancers. So this is also another
Stomach
adverse effect.
cancers,
Yeah,
yeah.
stomach cancers. And it can also increase your risk of developing melanoma. So melanoma is a skin cancer.
Yeah.
So this glutathione use can also increase the susceptibility towards development of melanoma in the long run.
Yeah. Yeah, so actually, out of these 4 clinical trials that have been done so far, only 1 out of these 4 clinical trials have been done with IV
IV
glutathione.
glutathione,
Like,
yeah,
have used IV glutathione, you know.
Yeah.
The other clinical trials, the other 3 out of these 4 clinical trials,
Were oral
they were oral and they had used oral and topical forms, right, which
forms,
are
yeah.
already FDA approved. So in this podcast, guys, we are talking about IV glutathione
Yeah.
because that is the one that is not FDA approved.
Yeah, and most commonly used also, basically.
Most commonly used, yeah, as well.
So these products, they are commonly used by South Asian populations because they think that if you have a brighter skin, you'll be more attractive to your opposite gender, and
Yeah.
this can increase your chance of getting married at the desired age, right?
Yeah.
So these skin lightening products, it's estimated to constitute a $500 million industry that basically benefits from exploiting your insecurities and anxiety of
Yeah.
people.
Yeah.
And it is also one of the most common form of body modification practices in the world that is damaging.
Yeah.
And when I went through YouTube to research for our podcast, I was alarmed by the amount of content that is promoting the use of these injections. And there were even channels recommending people to self-inject glutathione.
Yeah.
It is very dangerous to give yourself an IV injection.
It's crazy out there.
Yeah,
Yeah. So now let's give
a summary.
a quick summary of why you shouldn't use glutathione, right?
Yeah. So there is lack of published or reliable source of evidence that's supporting the use of intravenous glutathione in skin lightening.
Yeah, I mean, we don't know the dose, we don't know the duration of the IV injection, for how long you're supposed to give it to produce skin whitening, you know.
Yeah.
And I mean, you might need to take this your entire life
Yeah.
to get the desired results you want, to get the amount of skin whitening that you want,
Yeah.
you know.
And there are multiple adverse effects that are reported by the FDA as well.
Yeah, and there were multiple warnings given by the Philippines, you know, right?
Yeah.
Philippines FDA, was
FDA,
it?
yeah.
FDA, regarding the off-label use of IV glutathione, you know. And yeah,
And the high cost of these injectable
definitely.
glutathione vials. Why would you spend so much money to harm yourself?
yeah, and guys, there's always safer options of glutathione. You can get glutathione from fresh foods. You can eat healthy, right?
Yeah.
Fresh foods and vegetables and even nuts, right?
Yeah.
I mean, natural sources of glutathione are there, you know, like avocados and oranges and, you know, tomatoes, yeah. What else?
Walnuts, and also whey protein.
Yeah.
It is another rich source of glutathione, and has been used to enhance glutathione levels even in conditions like cystic fibrosis also.
Oh, okay.
Yeah.
Okay.
And
Yeah.
also mineral sunscreen.
Yeah, yeah.
The use of sunscreen have also proved to improve hyperpigmentation, even conditions like melasma. So religiously applying sunscreen can also help you have a brighter and healthier skin.
Definitely. And guys, all these scammers, they know that you're desperate for lighter skin. So they don't care about your health. They just want your money,
Yeah,
right?
they're
Means
good.
they will inject very high doses just to make you happy, just to, you know, give that
Temporary
lighter
happiness.
shade you want.
Yeah.
Yeah, it's
Okay.
temporary happiness.
They're going to use your insecurities to be rich.
Exactly. So guys, take the tablet. You can apply the cream, but we're just saying don't take these drips, right?
yeah.
And after saying all this, if you still want to do it, that's fine. I mean, But the thing is, before you do it, make sure you verify the source, because there's a high risk of adverse reactions, as we mentioned before, when it comes to using IV glutathione. So if you're going to do this, I would go to a doctor to get something like this done. I would check things like the manufacturer, the dosage, right? And yeah, ask your doctor the side effects that it can cause, right? If you use it for longer periods of time, you know. I mean, this channel is all about evidence-based information, so we are encouraging safety here, you know.
Yeah. All right, so that's the end of our podcast on glutathione, and thank you for listening, and see you on our next podcast.
Yeah, have a nice day.
Have a nice
Bye-bye.
day.